My name is Chrissy Bribel. I'm a family nurse practitioner. I work at Sentara Surgical Specialist in Elizabeth City. Colon cancer is the third leading cause of death among men and women in the United States. It's being found earlier and earlier ages. Colon cancer can be present or polyps can be present and can worsen without any symptoms. So screenings are done even when there are no symptoms present. In the past few years, the starting age for colon screenings has reduced from age 50 to age 45. The data shows that colon screenings are very successful in detecting colon cancer early or even preventing colon cancer. However, polyps and even colon cancers were being found in younger and younger patients. For all patients, they should have their first colon screening by age 45. We strongly believe in colonoscopy. It is the gold standard for colon screenings. The main reason being there's direct visualization inside the colon where they can see polyps directly. Polyps can be in there with no symptoms, but they can see them directly and get them out before they change or turn into something bad. So if for colonoscopy, the normal screening interval is up to 10 years. That is if everything is normal. There can even be normal polyps removed. And if there's no other concerning family history of colon cancer and such, you can be 10 years. For patients that are at higher risk, that would include patients with a family history, particularly first-degree relatives, ulcerative colitis, Crohn's disease, or even family history of multiple polyps. That screening interval also goes down, and it is based on a patient-by-patient recommendation. For any patients that are nervous about getting colonoscopy, I would just like them to know that our providers are very well versed in performing this procedure. The procedure itself is done in the hospital setting, number one, for the equipment, and number two, because there will be an anesthesia provider with that patient the entire time, giving them sedation so that they are very comfortable. The medication wears off very quickly afterwards, and most people do just fine. This is a very easy procedure, although every procedure has its risks. The risks with colonoscopy are very, very low, and patients usually do very well. I just love seeing patients. I love treating them like my own family. I love making sure that they get the care that they need, the screenings that they need to keep them healthy. I love hearing success stories when patients come back in and you see that they're happy and you're helping to keep them healthy. This is what my job is all about.